Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Thank you. This is David Lee from Prevent Connect. Welcome to today's Power and Prevention Ending Child Sexual Abuse web conference series. Today's topic, updates on child sexual abuse prevention with elementary ages. Prevent Connect is a national project of the California Coalition Against Sexual Assault and sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, CDC, or CalCASA. Thank you. It's a pleasure to see so many of you here for such an important topic. This is a topic that is near and dear to my heart as someone who's been involved in child sexual abuse prevention for decades. And in fact, before I introduce the speakers, I first met Cordelia Anderson about 30 years ago when we were involved in national work. I was working in the San Francisco Bay Area, and Cordelia at the time was at Illusion Theater in Minneapolis, and we were part of a national network of people that were working on child sexual abuse prevention, and it's been great to be able to see this work continue, and it's so important that we think about how we can do this prevention work. So with this, I'm really pleased to be able to introduce our series co-host. We have Cordelia Anderson, who, as I said, she and I have known each other for quite a long time, and I've also known Joan Tabachnik not as long, but for many, many years, over a decade. And so, Joan and Cordelia, I'm going to hand the podium over to you, and thank you for taking us for today's topic.
Thank you so much. It's great to see so many people. It's wonderful to be in our 5th series together here again today. And I want to first start us off by just addressing our learning objectives here. So let's see, I think I'm going to either get the podium or you can just transfer to the next slide so we can go to the learning objectives. And for those of you who have been on these webinars before, you know that Joan and I have an opportunity to just have a few minutes to speak with you all, put a little context to why this topic. So our learning objectives today are to help us all understand how the research has driven the evolution of child sexual abuse prevention programs over time. And for me, it's since 1976. And David, you were pretty early on there, so it might be much longer than 30 years, actually. And we also, though, are very excited to bring you the latest information about the impact of social-emotional learning as an essential foundation of primary prevention, and to look more at opportunities for collaboration with school systems and how to do prevention plans, how to keep those on track, and very importantly, how to explore the prevention efforts, how they can be inclusive of children with disabilities. So this session, in some ways, for many of us, might be full circle in that it is where I started my prevention work in the mid-'70s, as David referred to. And at that time, we knew very little other than that there was a huge gap in needing to talk to children, but there was no way we could do education with children without also educating parents and the professionals in the school system. Otherwise, we couldn't even get access. So at that time, for those of you who might remember that, the focus was much more on strangers, and we wanted to do much more comprehensive approaches. But let's take just a quick journey through history, Joan. You can talk a little bit about even before the 1970s.
So I think just what I wanted to be clear, and I think just that it's hard, I think, sometimes to imagine what it was like then, especially if you weren't there, but that literally that in the 1970s that there was complete silence about this issue, and that breaking the silence was really the rallying cry of the movement. And there was nothing on TV, there was nothing in the movies. And I mean, I was always struck by a friend of mine who, in her first college psychology class, said that, you know, what she had heard her professor say, that child sexual abuse is the last taboo, it just didn't happen. And I just always wonder what that was like for my friend who was a survivor and all the other survivors in the room, and how different that is from today. And then just going on to sort of the next slide, where we think about where we moved from the 1970s, that really as the people began to become more aware that we started having certainly mandated reporting laws, which were passed in '74, Then they had the Victims of Crime Act passed in the 1980s. We had Jacob Wetterling Act, Megan's Law, and then the Adam Walsh Act. We also had, a variety of different programs that started appearing on TV. The Law and Order Special Victims Unit. Oprah had, covered this show, as well as many, many other shows. So we've had a visibility now that just was not imaginable, I think, before the 1980s. And that kind of leads us maybe to where we are today, which is thinking like we have it feels like there was a moment in time, and that certainly there's been a lot of visibility to this issue, starting with with Sandusky, certainly what's happening right now with Me Too. We also have the beginning of rallying, so the beginning not just of a number of national organizations, but national organizations working together. So we have this moment in time where we have the opportunity to work towards change, and within that change, over these decades, there's been an external change, but also, as Cordelia mentioned, there's also a tremendous amount of change that's been happening in what we've learned, particularly about child sexual abuse and how we go about preventing child sexual abuse. So some of what we've learned, and I won't go through all the different pieces, but this is just I think gives you an inkling of how much we have actually changed over the past decades. And this is not an exhaustive list, but certainly where we go, right at the top of the page, how much has changed around technology, both off and online issues. We have so much better understanding of brain development as well as social emotional learning, and just what we know but developmentally about children. Each one of these blocks are represented as a major aspect of what we've learned today, and how we actually go about doing our prevention work differently. And that's why we wanted to bring in two people who we just both have tremendous respect for, who have incorporated a lot of these kinds of changes. So back over to you, Cordelia.
So all of that said, one of the other people I met early on in my work in the 1970s was Dr. David Finkelhorst. So if we can, let's see, switch us over, I can get to the next slide, or if somebody can just give me to the next slide, because I know that Dr. Finkelhorst also advised Committee for Children and some of their changes in their research. And one of the things he said back in 2007 was the weight of currently available evidence shows that it is worth providing children with high-quality prevention education programs, and this needs to be all children, culturally specific, dealing with children with also addressing children with disabilities, looking at how we get children throughout our country and our world high-quality prevention education programs as one piece of all of what's needed for prevention, referencing back to the last slide. And I think one of the issues that these presenters I'm about to introduce really help us with is we know that it's a lot easier if all children equally we're able to get a core nutrition, if you will, the social emotional learning skills. We're able to get core supports, core protective factors. Then when we wanted to give them kind of the vitamin dosage of very specific skills or information related to a specific problem area, abuse or trauma, all of that is going to take more. And that learning, as opposed to trying to just do one session on one topic, we've all learned over the years the importance of that comprehensive effort that takes into account the whole child. So I am absolutely thrilled that we have Bridget Norman and Meg Stone, and I'm going to introduce them both now. We're going to begin with Bridget, who many of you may know is the Director of Education and Learning at the Committee for Children. And again, that is a well-known U.S.-based nonprofit whose mission is to foster the safety and well-being of children through social emotional learning and development. Bridget's been there 17 years and has been designing and creating that content for research-based programs to promote social and emotional skills, also preventing bullying and protecting children from sexual abuse. And all of their programs include student, staff, and family materials. Most recently, she led the development of Second Step Child Protection Unit and was a developmental consultant for, and I love this, the MindYeti.com, online mindfulness resource for children with adults. Bridget previously was a teacher, school counselor, prevention specialist, and parent educator, and pulls all of that together in the work she does. And Meg Stone is the Executive Director of Impact Boston, an abuse prevention and empowerment self-defense program that is embedded within the Disability Service Agency Triangle. There, she's also the project director of Impact Ability, which is an abuse prevention program focused on people with disabilities. And that was launched from a Robert Wood Johnson Foundation grant. She leads the organizational abuse prevention efforts of Triangle and 3 other Boston area disability service and advocacy organizations. So under her leadership, Impact was chosen by Just Beginnings Collaborative as one of 10 organizations to receive grants to address child sexual abuse. And through this work, she's working with SEAM Educational Collaborative, a network of schools for children and teens with disabilities, to create and implement system-wide child sexual abuse prevention and response plans, which you'll be hearing more about. She's a member of Massachusetts Sexual Violence Prevention Team and the chair of their Developmental Disability Subcommittee. She's written several articles in many different journals and newspapers. So we are delighted to have both Bridget and Meg to really address the state-of-the-art of where we're at today with these issues. So with that, Bridget, I'm going to turn it over to you.
Okay, thank you. I'm waiting to see where I can advance.
We've just got to get you in the podium, and we'll be able to move you over. So
okay, perfect.
You can also, okay, and you can start talking, and we'll catch up to you here with slides when they switch. There, you're in podium now, so it should be okay.
Okay, there I am. Hi, everybody. I'm very excited to be here today to tell you a little bit about the history of Committee for Children, where we've been and where we've ended up. So Committee for Children, as Cordelia said, is a nonprofit organization. We're based in Seattle, Washington. And we were founded in 1979, so during those 70s. And really our organization is rooted in the work of 2 cultural anthropologists, Dr. Jennifer James and Dr. Deborah Boyer. And in the 70s, they'd been working with youth on the streets of Seattle. And what they discovered with their conversations with these youth, that many had been sexually abused and then went on to be trafficked. So this led them to think about how can we prevent this, and so they formed the Committee for Children with a focus on preventing child sexual abuse. So this story is the heart of our work and really is our origin story, if you like. So this focus on prevention of child abuse led Committee to Children to develop the Talking About Touching program. This was a school-based curriculum taught to children from preschool through 5th grade by teachers or school counselors. It used a personal safety framework and taught things like touching rules and ways to stay safe, and obviously a focus on reporting, and was based on the best research at the time about how would you teach actual skills to children. And they collaborated with the University of Washington, some researchers there, to figure out how to do that. So it is based on research, and it's also being evaluated for effectiveness. However, in the early 80s, Committee for Children consisted of just a few employees and some high-profile community volunteers who spearheaded grassroots efforts right in Seattle to secure funding and build the mission. This small group of social workers and educators worked largely, as I said, locally, with the Talking About Touching program used in local schools. But that all changed when Nashville Public Schools somehow heard about the program and requested it. And then we had to figure out, well, how do we scale up the publication and distribution of the program, which we had to figure out how to do. But then in the mid-1980s, we began to ask the question, is teaching children, parents, and teachers skills to deal with abuse once it is occurring primary prevention? Because what we kind of knew about talking about touching is really it encouraged disclosure. And we weren't really sure what was the level that was really primary before this. And that led us to ask, well, what makes people victimize other people in the first place? If we want to do primary prevention, we really need to figure that out. Violent offenders are, as you can imagine, an oft-studied population because they cause great harm to society. and they are literally a captive audience, so they are studyable. And what we found was by looking at the research that there are lots of causal factors about why offenders offend in the way they do, but one that jumped out at us was a consistent finding that showed that violent offenders, adults as well as juveniles, lacked a core set of social emotional competencies: empathy and perspective taking, self-regulation, emotion management, and social problem-solving skills. This led us to theorize that if we taught people these skills at an early age, when it's in their developmental pathway to develop them, versus doing empathy training with 40-year-old sex offenders, for example, we could perhaps change the trajectory of potential offenders to help them become more pro-social, less antisocial, and by extension cause a decline in victimization. So this led us to ask, how have these skills been successfully taught to children? And again, we turned to research. We drew on what is now decades-old research from field leaders such as Albert Bandura, Norma Vesbach, Vivek Shure, Ken Dodge, Philip Kendall, and others. And from this research, we created the first edition of the Second Step program. And this was Committee for Children's Second Step. So it became called the Second Step program. And that came out in 1985. We have had remarkable success with this program, and it is now in its fourth edition. In 1997, a landmark study, a randomized control trial, was published in the Journal of the American Medical Association, showing significant effects from the Second Step program. And this led to much greater uptake of the program in schools because they were confident that it could make change in children. Numerous other studies have followed, and then in 2001, we added a specific bullying prevention program, the Steps to Respect program, again based on research. However, until recently, the Talking About Touching program, our Second Step program, and the Steps to Respect program were separate offerings, not integrated in any way. And David Finkelhor and Lisa Jones, another researcher, were the first external researchers to suggest to us that we actually needed to integrate social emotional learning with child protection. That this was truly the right strengths-based approach. And in addition, we ourselves recognized that we were not doing schools any favors by asking them to layer these three programs together or make up how to integrate them on their own. And as each had a sizable amount of lessons, they really couldn't be fitted into a school year. So people would have to choose, do we do child protection? Do we do bullying prevention? Do we do social emotional learning? And we really did not want people to have to make that choice. So in 2011, we revised the Second Step programs from the early learning to grade 5 grade levels to become a foundational program in social emotional learning. We pulled out any social emotional skills that had been embedded in the Talking About Touching program or the Steps to Respect program and put them into this fourth edition of the Second Step program. This then allowed us to take Talking About Touching and Steps to Respect and really make them much smaller and focus them really on the core content related to either bullying prevention or child protection. And what we then came out with was this Second Step suite, because it had the core social emotional learning program plus smaller units that I'll talk to about in a moment that focused on bullying and child protection. So it really became an integrated program that they could fit in the whole school year rather than three separate programs. In 2014, we came out with our bullying prevention unit. This was based on the research around the Steps to Respect program and updated with current research on bullying prevention. And most importantly, it included very robust training for both school administrators and for all staff. Because what we knew is that policies and procedures about bullying are critical, and we also know that teachers have to learn how to recognize respond to, and report bullying. Otherwise, if a child comes to them and the teachers don't know how to respond and don't know how to report it, children will decide that teachers really can't help them. So this was very important. At the moment, an independent researcher has just finished a randomized controlled trial of the Second Step program plus the Bullying Prevention Unit, and they're in the process of analyzing the results. So we're looking forward to hearing what they found out very soon. And then moving on, in 2015, we came out with our Child Protection Unit. And again, this was based on our Talking About Touching, updated to include all new research. And in fact, David Finkelhor, someone called Keith Kaufman, some of whom you may have heard of, and Cheryl Shakeshaft, who's a leading researcher on educators' sexual misconduct, came and did a kind of a day-long think tank with us about really what was the important framework for us to have for this Child Protection Unit. And where we landed was that it really had to address policies and procedures at the administrative level. It had to address training for all staff in the building, and particularly address, because of polyvictimization, the training couldn't be specifically just focused on recognizing child sexual abuse, but really had to talk about physical abuse and neglect as well, although it still does have a preponderance of what it talks about as child sexual abuse. And we had to have materials for families and for parents, and of course lessons for children. And so this Child Protection Unit has all 4 levels. There's a module of online training for administrators, a module for school staff, lessons from early learning through grade 5 for students, and there's only 6 lessons, 5 lessons plus a review lesson. And then there's a dedicated free website called Early, Open, Often, which addresses families, educates them about child sexual abuse, lets them know how to have conversations with their children and how to respond to disclosure if that happens, unfortunately, in their family. There's also a Spanish version of that website as well. So this is the Child Protection Unit. There's a randomized controlled trial that has just started this school year. And again, we'll have to wait a while to find out what happens. But of course, absolutely everything in this program is based on research. So this is our Committee for Children commitment. When we create curriculum, we have to have them based on research and to find independent researchers to do effectiveness studies. We want to make sure they're multimedia rich and super engaging to children. We need to make sure they're easy to use for teachers, that they're developmentally appropriate, that there's practice of skills in every lesson, and that we have interactive, accessible online training for adults that is deeply integrated into the curriculum. So that's the end of my presentation. I hope you have heard just how deeply research both has informed and guided us as we have gone on our journey from 1979 until now. Thanks so much.
Well, thank you so much. That really was a fantastic overview. And I just want to also let people know that we will have a section at the time at the end for questions and answers. So if you do have questions, please put them in the chat, and we'll make sure we circle back to them. But in the meantime, we have a question that we want to both ask the audience, and then I'll circle back and ask you, Bridget. But that the question we have for you in the audience to think about is, what role does a school-based social and emotional learning program play for children who have experienced sexual abuse? So if you could, in the chat, put any thoughts that you have, and then Bridget, maybe while we're waiting for people to put in their chat, maybe we can maybe hear what your thoughts on that question might be.
Yeah, so what's been very interesting for us to see happen is, as schools are moving towards trauma-informed practices and really recognizing how they need to support children who are dealing with abuse or dealing with adverse childhood experience have ACEs. That's a universal evidence-based social emotional learning program is really a foundational practice. There's other foundational practices, but having that in a school is absolutely foundational for a number of reasons. One, it creates an environment in the whole school when all of the children are learning these skills where pro-social values are really embraced, where children know people are going to listen to me and I'm going to be treated with respect, and people are going to ask about my feelings, and other children are going to know how to solve conflicts with me in peaceful ways. And so that's helpful for children who are experiencing chaos and maybe violence at home to come into an environment where school is really like a sanctuary. And I think social emotional learning across the school really helps create that safe and supportive environment, that sanctuary for children. And of course, children who are experiencing abuse also need the social emotional skills that are taught in these universal programs. They really need to know how to identify how they're feeling, to know how to manage the kinds of feelings they're having, and also how to communicate those and express those to the adults around them. And children with high numbers of ACEs also are very impacted around their executive functioning and self-regulation. So having a program that teaches them those skills is extremely helpful.
Wonderful, thank you. And I think people have been echoing what you've said, and also add, I think, just some very practical ways that Matthew, mentioned that how you can access help, so that if and further on, some other folks have said, for those who may not actually know what is normal, what's normative, that it also gives those children a sense of how to recognize that their experiences that they have may not be normal, which is Cassandra. But I think people have some other great thoughts about their role, that they're just teaching children about what's appropriate, inappropriate touch, and I think just not just between adults and children, but between children as well, which I know Second Step does. And this supports support systems for the children in a space for them to feel comfortable. And I always love that the Boston Area Rape Crisis Center, they often talk about that when you open up the door to talk about this in the first place, you become askable. So you become a resource for the children, which is what Rosa mentioned as well. So there's some great comments in the chat. Thank you so much. And I want to just also, I did note a couple questions in there, which we'll circle back to after Meg has a chance to speak. So I think now I'm going to turn this over to you, Meg, to give your short presentation as well.
Sure.
Welcome, Meg.
Thank you. So the research and the programming that Bridget talked about really emphasize the importance of intervening on multiple levels of a school. And what I'm going to talk about specifically is an experience in one specific school that is a network of different school programs for students ages 5 to 22 who have a variety of different types of disabilities. This is especially important for child sexual abuse prevention because children with disabilities are so disproportionately affected by sexual abuse, but also because children with disabilities may not have access to the types of protective factors like healthy sexuality, like socialization that other children often have, and that a lot of the ableism that pervades our society often results in children with disabilities being more likely to be socialized to comply with adults, to be touched in ways they don't choose, and to be perceived not to have the capacity for sexual development. So within that context, what Impact is doing is collaborating with SEAM Educational Collaborative, which, as I said, is a network for children with disabilities, school network for children with disabilities. And the unique, unfortunately unique factor about SEAM is that they were motivated to take a very deep look at how they could prevent child sexual abuse in the absence of a crisis or a PR disaster. There is no sort of remediation of a bad outcome or a poorly handled sexual abuse incident. This is just a group of educators that sees a need and is willing to address it. So what we're doing is we are working with them to build an organizational approach to child sexual abuse that is unique to their school. And, you know, as we say as a shorthand, the goal of this child sexual abuse prevention plan is so that it feels like a part of the school. It feels like an everyday part of the school. Because every time we hear a news story about child sexual abuse, Penn State, the recent sexual abuse against people with disabilities that's been in the news, there's always one or two or a few people that sexually abuse, and there's many, many more people that don't intervene or don't know how to intervene or attempt to intervene but get undermined by people with power who do not want them to intervene. So what we're hoping to do is to look at the organizational factors that can prevent child sexual abuse and also do it in such a way that it fits the school. So the overall goal of our work is that the plan is consistent with the organization's mission, values, and culture. And ultimately, you know, as Bridget mentioned earlier, we cannot prevent sexual abuse with single training, but that gets integrated into the daily operations of the school, that is part of everything else the school does, and is also developed in partnership with administrators, staff, students, parents, so that it feels like a part of the school's mission. And that means that we're not just talking about responding to traumas or crises or abuse incidents, but supporting healthy sexuality, supporting people with disabilities in refusing unwanted touch, advocating for themselves, choosing what happens to their bodies. So the process of this project is to assemble a leadership team that any member of the school community could join. And together with the leadership team, we assessed the needs, strengths, concerns, fears, and hopes of the community. One thing that became especially important in the course of this project is to make sure those of us who were leading the prevention efforts were really listening to the problems that teachers, teachers' aides, and students were identifying, and making sure that any policy or process that we put in place with regard to child sexual abuse prevention was solving the problems that people were seeing and addressing the needs that people had. So we wanted to make sure that the plan really matched the organizational culture. For example, SEAM has a culture that is very focused on individualized learning for students. Students who need a disability-specific setting like SEAM often have a very individualized need that varies greatly from student to student. So the types of codes of ethics that work in other youth-serving organizations that very clearly define the types of touch that are appropriate and inappropriate were not something that matched the way that SEAM worked. There were other aspects of their culture that really dictated how we proceeded with the plan. And so the reason for the organizational approach and the rationale behind why we were doing this work, I really see organizational abuse prevention as social change on a manageable, measurable scale. So I do not know how to transform our culture or our society or what that even means. But there are microcultures and micro-societies in every school, in every youth-serving organization, in every other organization that supports children that can be impacted, and that can be impacted in a way that helps us learn what types of change prevent child sexual abuse. Because currently we do have a lot of data on individual factors and individual child sexual abuse prevention initiatives, but we are in the process evaluation stage with organizational prevention. So what my hope for this work is that it not only fosters inclusion, but it moves the research forward. So the other important aspect of the way that we approach this work is to recognize and respect the very difficult ask we are making of teachers. So teachers, teachers' aides, counselors in an environment like this are interacting with students who struggle to communicate, who are very easily thrown off if their routines are disrupted, who either because of disability or trauma are triggered by a lot of everyday experiences. Also, this is a school system that educates children who did not get what they need from their local public school. So there's often an experience of distrust and an experience of frustration about working with a school system. So the goal in this high-stress environment is to create the kind of trust and mutual respect that gives people the fortitude and the support that they need to grapple with the pain and complexity of child sexual abuse, but not have that mutual trust create the kind of loyalty that promotes silence, that I'm so trusting and I'm so loyal that I'm not going to believe this student who's reporting to me, or I'm not going to intervene when I see somebody abuse power or violate a student's boundaries. So in asking folks to do that, really what we're trying to do is create an organizational practice that stays away from the extremes. It is very, something we really want is to assume that everyone we work with is safe and everyone we work with comes to this work out of commitment to children and commitment to, helping them thrive. On the other hand, we know that child sexual abuse is mostly perpetrated by familiar people, and we cannot assume that in all cases. On the other hand, we don't want to have a closed or suspicious community because that doesn't serve either child sexual abuse prevention or the other educational goals of a school. So I remember at the very beginning of this project, even people that were extraordinarily committed to preventing child sexual abuse wanted to talk about child sexual abuse perpetrated by bus drivers who don't work for the school, or parents, or somebody other than their coworkers. So what we had to do is create the kind of trust and the kind of fortitude and the kind of organizational environment that would allow folks to reckon with the reality that people they like or trust or respect could be at risk to perpetrate. So another thing that we thought very carefully about in this intervention is what are the conditions in an organization in which child sexual abuse can thrive? Because any person could interact with someone who's at risk to perpetrate, but what can an organization do to create the opposite of the types of conditions that abuse thrives? So a lot of the themes were constructive challenge, power sharing, and most important with all children, but particularly important with children with disabilities, is supporting people in refusing unwanted touch, advocating for themselves, and making choices about their bodies. Also very important is basing any organizational strategy on a clear definition of the organization's culture, the organization's values, and the organization's expectations for its work and itself. All organizations value safety, all organizations want to see children thrive, but we took a very, very specific look at this organization and what was going to make a child sexual abuse plan thrive within this setting. I'm just going to briefly discuss some of the areas of the plan that were decided by the leadership team. I didn't come in with a set of policies and a set of procedures. I came in and said, what are the needs? How do we address them? How are you as a community going to make children with disabilities safer and support survivors with disabilities? So these are the areas of the plan that the leadership team identified based on a facilitated process. And in each of these areas, there are goals, action steps, and most importantly, it has become part of people's job descriptions and part of people's daily work. I'm not going to read the excerpt, but one important aspect of the Child Sexual Abuse Prevention and Response Plan was ensuring that it had a very strong connection to the school's mission and the school's values, so that it became integrated into everybody's sense of their work. I'm going to talk now very briefly about one aspect of the plan. A lot of organizational child sexual abuse prevention work talks about official policies. And one of the real challenges or hesitations that a disability-specific environment has is that a lot of policies and a lot of ways that adults are expected to behave may not have the variability that people feel they need in order to effectively support students with disabilities. SEAM, in its organizational culture work, really identified itself as an organization that was individualized, that was not unilateral, that made decisions by inclusive team process. So the touch guidelines had to match. So we wrote and implemented a set of guidelines that was designed to help educators self-reflect and challenge each other on why they were touching students. And this is not just to prevent child sexual abuse. This is to socialize students with disabilities that they have choice over their bodies, which is a protective factor that we recognize. So while a touch guideline in another type of organization may outline specific types of touch, the touch guidelines at SEAM looked at the rationale behind the touch, and we also did some skills training with staff around how to constructively challenge a coworker if they saw a type of touch that they didn't feel was appropriate or was serving the student. We implemented the touch guidelines at the beginning of this school year, and the evaluation is still in process. So I'm just going to give you the very first survey results from the process evaluation that we did. 100% of people in an anonymous survey recalled the guidelines unprompted, and a majority of folks intervened or observed others intervening when the guidelines were not followed. People were mixed in terms of how often they thought of or referred to the guidelines, but only 15% never consulted them. There was mixed results as to whether they were helpful. The majority of people found them neutral and unnecessary. However, the folks that found them helpful identified situations in which they were able to think differently about how they were touching a student, or think differently and be able to speak to a coworker when they saw something that concerned them. So really what we're looking at in a disability-specific school system is something that we believe is necessary in any type of school system, for the organization to really look at itself and look at what its values are and what its mission is. And also look at the conditions in which sexual abuse can be perpetrated in an organizational setting, and design a prevention plan that uses the organization's values as a guide to create the opposite of an abusive situation. Thank you.
Excellent. Excellent. Thank you so much. Again, a fabulous presentation in a short amount of time, an amazing amount of information shared. And we do have a slide where there's a lot of questions. I know Joan and David and I are all tracking your questions that are coming up in comments, so we can bring that into the discussion. But I want you all to first think about how you think sexual assault organizations and school systems assess whether and how to collaborate on child sexual abuse prevention plans. And I want to start first, maybe while people are thinking about how organizations should do that and how they can do that, maybe Meg, to give you a chance to say a little bit more about that while people are responding.
Sure. It's a really different facilitation process than I've done in other types of contexts, because you're, in any school system, but particularly a school system that is only students with a lot of needs and a lot of challenges, there is always the task of making child sexual abuse prevention a priority. So keeping the group on track, keeping enough focus on the vision and the big picture and the mission so that people come to leadership team meetings and feel as though they have a chance to reflect on important issues around education. And they are really doing work that is going to directly, positively impact students. There are some people who were weighing whether to leave the leadership team because they didn't want to leave their classrooms, but really saw the big picture around what they could do as part of the team. So it's sort of holding the mission and the vision of the school at the same time as being very concrete, very task-oriented, and very connected to the daily implementation, because I think providing that support to very busy, very overwhelmed people is more likely to make sure it happens. I think from a school system perspective, anyone on this webinar has probably worked with many school systems that, only want a short training. I think the school system has to be ready to make a strong commitment to this work and view it not only as a way to stop child sexual abuse, but to have the kind of critical self-reflection that's going to make all the programs better. And that means being ready for critical self-reflection, because there's a way in which addressing child sexual abuse within an organization makes us reflect on all of the unchallenged assumptions that we have, when we work with children, when we interact with children, what we teach children, what we're silent about, what we talk about. And it's incredibly helpful work, but it's not easy work.
Great, and there's a range of responses here from people from sexual assault programs doing their own assessment of their strengths against the assessments of the schools, doing that together and seeing if they're a good match, to suggestions of more mandatory partnerships between different programs. So there's a lot of different thinking there, and we've been trying to capture some of the questions that come up. So we want to just open up the discussion, because you two just did such a fabulous job of giving so much information in a short amount of time. Some of the questions, Bridget, let's start with you. One of the questions was, and I'll combine this, what ages are your programs used for specifically? They asked, one was about Second Step, and there were other questions about others, so specific ages. And if you can if you have any idea of how extensively your program is being used by schools, where all it's at.
I can tell two things. One is the core social-emotional Second Step program goes from early learning all the way through to grade 8. Our child protection unit goes early learning all the way through to grade 5, and the bullying prevention program is kindergarten through 5th grade. And what we know from a big study we had an outside organization do is that certainly in the elementary schools, our programs are used by about 30% of U.S. elementary schools. So we're in many, many, many thousands of classrooms across the country. And more we're seeing that schools buy the whole Second Step suite, so they're buying the child protection unit. So what we know is many more schools are using our child protection unit than ever used our Talking About Touching program. So that to me is thrilling, very exciting.
Great, and here's a question from, sorry, go ahead, Cordelia.
No, go ahead. Yeah,
no, I say, and so maybe since you have one for, maybe a question from Meg that came up where I think Shelby had said that, I think commented, which I think we all would agree, that children need touch, but that sometimes children with some disabilities may have a hard time knowing the difference between what's safe and unsafe. And so the question is sort of how do you address that? And particularly add my own piece to that is also not just in terms of what you talked about, refusing touch, but also around the perpetration of that touch if they don't have a full understanding of what's safe and unsafe.
Right. So that's why it's a touch policy, not a no-touch policy, because there is safe and healthy touch, and there are students who need certain types of touch as part of reasonable accommodations for a variety of different reasons. So that's why within this particular school setting, but I think could be useful in all school settings, that we took a very reflective look at why is touch a problem? You know, it can be really healing, really positive, really healthy for students to get touch, but touch is a problem when it's unchosen, when it does not serve the student, when it's abusive, or when it's outside of the role. So outside of a teacher or, you know, teacher's aide's role might be different than is outside a physical therapist or occupational therapist's role. You know, that answers one part of the question. Another part of the question is that the impactability curriculum in particular, we do have an empowerment self-defense curriculum that specifically teaches folks with intellectual disabilities to recognize and resist unsafe touch and to report to a safe person. But also to, you know, we have a healthy sexuality and healthy relationships aspect of it that teaches folks with intellectual disabilities to identify touch and intimacy that they do want and that they are seeking and how to get it. I think, you know, one thing that we've found in our work is that if the skills and concepts are presented in simple, concrete terms with experiential teaching, things like role plays and pictures, then people with intellectual disabilities recall and remember it. We did a research study of impactability and then did a follow-up training a year later with no additional booster training and found that people remembered all of the concepts of the training. So I know that it is a different way of teaching to teach people who learn in simple, concrete ways, but it is definitely something that is doable, and it's something that preventionists can and have done. Was that the whole question?
Yes, fantastic.
Okay.
And Bridget, I wonder if you have anything you might want to add to that at all, or from your perspective?
Well, I absolutely think you can teach skills. You know, we start with 4-year-olds. We make it very, just like Meg said, very concrete. It's based on a personal safety rules framework so that it's not seen as a scary thing at all. We're having rules around, you know, matches or rules around, you know, crossing the street. So there's rules around touch as well. And we have kids identify safe touches, and then we have them think about unsafe touches before we even get to rules around, you know, touches that are inappropriate or could be sexually abusive. So, and again, we teach kids rules, so, and teach them this is what's right and this is not what's wrong. And so it helps the kids have a conversation about that, to identify things, for the teachers to feel more comfortable teaching it. Because again, as Meg said, very concrete. We have pictures, we have videos, we have kids practice the skills, we have them remember the rules. And again, we find, as Meg did, that when it's taught in that way to young children, they do remember. And so, you know, it just supports what Meg's saying.
There was a comment early on, and I'm going to ask both of you about this, about that so many people are seeing such an increase on peer-to-peer harmful sexual behaviors, and that some of that may be because it's reactive or mimicking things that has happened to them or other traumas in their life. I would add to that we also see some of that because they've been exposed to pornography that is well beyond their years. For whatever combination of reasons, we're seeing more young ones with really problematic and harmful sexual behaviors. So I want to start with, and that gets added complicated when you've got intellectual disabilities and how we frame that. So Meg, I wanted to just start with you and then go back to Bridget on that comment. What are some of the things you do that specifically help in some of those instances or guidelines you have for people?
Yeah, and that's, you know, the in the areas of the prevention plan, the SEAM team was very committed to both a healthy relationships and healthy sexuality framework that both taught the skills to communicate boundaries, and taught the skills to respect boundaries. And also, that is also part of the plan in the section focused on prevention skills for students. It can be really challenging because of all of the ways in which students with disabilities are perceived, to sort out, what is a problematic sexual behavior and what is a person being uncomfortable around a person with a disability. We had a situation once in a public school where a young man with a disability told a young woman without a disability that he wanted her to be his girlfriend, and it doesn't look like he touched her or anything like that. But she got afraid, and he was pretty severely reprimanded, I think because he approached it in a way that was not socially conventional. So it is something that that is really, I'm trying to give a simple answer to a complex issue, but it is definitely, something that is part of the prevention plan when it comes to teaching healthy relationships, teaching healthy sexuality, and, specifically with teens with disabilities, supporting them in having adolescent sexual exploration that adolescents without disabilities have much more access to, and at the same time preventing sexually abusive behaviors, preventing dating violence, preventing sexual assault, and addressing peer-to-peer, like our Impactability program for students addresses peer-to-peer sexual violence in addition to caregiver sexual violence.
Great, thank you. And Bridget, did you want to add to that some of the things you see in your program that help? Because you opened with some things related to that.
Yes, we know that 40% of offenders are adolescents or peers. That is just, and I don't know whether that's growing, but we know that it's very important to teach kids that when we're saying these are the touching rules, and then we have scenarios that they're practicing with, the scenarios have in them peers, older students, brothers and sisters, teachers, neighbors, aunts and uncles, grandparents, all of the kinds of people that could offend against them. We make it very clear. And as kids get older, our touching rules expand for them to also understand. It also includes people asking to see them without their clothes on, to look at their private body parts, to touch their private body parts, have them touch yours, so that as children get up to 4th and 5th grades, we really expand that. And we have scenarios, too, that we don't call it pornography, but it's about looking at things on cameras or having people show them things on iPads or wanting to take photographs of them in certain ways. So we are hopefully, expanding the notion of what it means and giving kids the skills to recognize those things, and also making it very clear to them it's not okay for you to touch another child's private body parts. And of course, we're not dealing with teenagers, so we don't have to get into areas about healthy sexuality. But if we ever expanded our child protection unit into the middle school years, we would have to figure out how to do that, because, as Meg says, it's clearly very important to do that as well.
This is a great follow-up question, I think, to this conversation, which is, that I think sometimes you're using the word rules, and and I know that having, like, when my children were 5, they loved the idea of rules, but also rules can also in some ways provide some sense of children might feel like they're blaming themselves if they didn't follow the rules. And wondering if maybe talk a little bit about what language you might, what we think about language in terms of teaching. Maybe one person suggested using safety skills or focus just on boundaries. I wonder if you could each speak about that. And Meg, since you already started joining in, maybe you could start with that.
Yes, we definitely talk about, we talk about skills, we talk about tools. It is a challenge with adults who work with younger children because younger children are much less independent than, older older children and adolescents. Something that our team, particularly those that work in the elementary age group, are looking at is introducing concepts of consent in ways that are appropriate for 5-year-olds, and introducing concepts of consent that are appropriate for 5-year-olds with significant delays in language development or other delays in learning when it comes to sort of practices of touch. But I do think it is a real, there's not an easy answer to that because, there are many things that adults need to decide for children in order for children to be safe and happy. And there are other things that other ways that adults are controlling children that are unhealthy and harmful. So it does take a lot of nuance and it does take a lot of reflection, which is why I think the process of working with the school system in the way that we are really helps. We could have a whole session on, touch or, how we communicate with children about touch, what language we use, what boundaries we use, because I think we are shifting so many norms when we are engaging adults to prevent child sexual abuse and when we are helping children develop social and emotional skills as a protective factor against perpetration, that any language that we have that we love today is going to be inadequate tomorrow. So it is an ongoing evolution.
Yeah, and I really do appreciate that both of you are talking about the importance of touch, and as opposed to moving towards the, what I think is legally maybe easier but no touch policy. Bridget, I wonder if you want to comment anything about the idea of the language in terms of rules and versus skills or boundaries, things like that.
Well, we found with very young children having a very clear rule, it is never okay for someone to touch your private body parts, is very helpful for them. They don't have to think about, it's grandpa or it's this or that. No, it's never okay. And for young children, that's very helpful. But then we teach them skills in how to recognize unsafe touch, how to report it and tell somebody. We teach them it's never their fault if someone else breaks the touching rule. Never, ever. Never to keep secrets, and to keep telling until someone listens to them. And so the rule, just for the younger children, of course, the rule changes as they get older, and probably by the time they're in adolescence, and we haven't gotten there with our program, it wouldn't be rule-based anymore because everything becomes very much more nuanced. And you have to bring in, normal sexual development and healthy sexuality and adolescent relationships and all of those kinds of things. But we're talking about young children in elementary school. So again, we found framing it as a rule, we teach it in the framework of personal safety so it doesn't seem scary to them. They have rules about fire and rules about guns and rules about other things as well.
There was another question related to how your different programs or what kind of advice you would have about how to help children when they have an empathy deficit. It doesn't seem to be naturally as present for them. So we can talk about that specifically for children with disabilities, but also what you would see, Bridget, as well. But Meg, you want to take that first?
I'm going to ask Bridget to take that first.
Okay.
If you don't mind.
Okay, so, empathy is a complicated thing. Empathy, there's for one, there's two kinds of empathy. There's affective empathy, and then there's cognitive empathy, which is more perspective-taking. And what the research shows is that you can teach cognitive empathy more effectively than you can teach the affective, which is feeling how someone else feels. The cognitive is knowing how someone else might feel. But empathy is not necessarily caring and concern or being concerned about how someone else feels. So, for example, children who bully others often have pretty high levels of cognitive empathy. They know exactly how someone else might feel if they call them a name or if they take something of theirs. So what has to happen is teaching empathy, but also teaching kindness and teaching teaching concern for others. That if I see someone who's really sad, then the kind thing is to do something that's going to maybe help them feel better. So in our program, we do both. We really teach kids to identify their own and others' feelings. We teach them perspective taking, but we also really emphasize kindness and care and concern.
Okay, I've got a follow-up question, Megan, if you want to jump back in this. But I just got to ask, I remember a time when I was doing a statewide mass media campaign on You're the One Who Can Make the Peace, and we celebrated peacemakers large and small, and then we had a governor elected who had been a former, all-star wrestler. Used a lot of kind of bullying behaviors that affected that. We're in a climate where there isn't a lot of kindness in our leadership. You, in various ways, in the adults kids see. How do you see this come up in your programs? And how do you help children really stay focused in values, the skills, and programs in a climate, be it our media or be it our leadership, that doesn't always reinforce that?
It's interesting. I've actually, in this particular program, I've observed it have more impact on adults. That doesn't mean it doesn't have an impact on children, but I know that, in this climate where, we can't watch the news without major stress hormone activation, and what I've seen in the school system that I'm working in is a real urgency to develop a culture and practices that support kindness, that support social justice, that support the agency of students with disabilities. And I think there's a way that people are understanding resistance as something that has to be done through empathy and kindness and generosity, and with organization level work, this sense of, I've heard this from many of the educators I work with, it's like, we can't control a lot of what's happening in our geopolitical world, so let's do something important in this school that we have a lot more say over what happens. And let's implement a culture here, and let's implement values, and let's implement practices and skills that are going to reckon with safety and that are going to give students with disabilities the message that their bodies are theirs, that they have the tools to advocate for themselves, and also give them the tools to respect other people's bodies.
Thank you. Did you want to add anything to that, Bridget?
No, I would just agree with Meg that I think schools and school districts are really, really honing in on the fact that it's so important that they create an environment in a school that is safe and respectful for every child in that building, and that having a universal language that can be built through having a universal program like a social emotional learning program, teaching both adults and kids the skills to have both the empathy but the care and concern for others, to teach the bullying prevention and the child protection kinds of things. They see that as more and more important, especially in schools that are very diverse, where you have children from many different backgrounds and a lot of immigrant children. They truly see that creating that sanctuary, that safety for children is paramount, and that is something that they can make a difference with.
And I think we have time for maybe at least one more question. And one question I thought was interesting is I hadn't heard this before, was that, that have either of you faced a situation where because of the programs you're doing that that a child maybe discloses almost too much in the school, which makes it harder when they go to a child advocacy center or go to a more forensic interview process? And was wondering if either of you have faced a situation like that. And since we always start with Meg, I'm going to start with Bridget on this one.
I haven't worked in a school for many, many years, but I do know what we have in our training for all the adults in the building in our child protection unit is a lot of examples of how to have conversations with children or how to respond to a disclosure where you're really not asking questions. You're not asking any questions at all. You're just saying, tell me more, until you have enough information to go, okay, this is clearly something that needs to be reported. Because again, the danger is if an adult asks too many questions, then the child is going to disclose too much, and then that does create problems. So we have a lot of modeling. We actually have, you can watch conversations on that training and look and see what the adult is doing and how they're both, making a safe environment for a child to tell as much as the child needs to tell, but the adult is really not asking questions.
Yeah, we actually, in SEAM collaborative schools, I've faced a very different problem. When I first came in to introduce the child sexual abuse prevention program, I did a series of listening sessions with different schools and heard repeatedly that children were reporting sexual abuse and the child protective workers were unable to understand or communicate with them. And so a major challenge that the SEAM team is looking at with the Child Sexual Abuse Prevention and Response Plan is what the school wants its role to be in terms of advocacy with child protective workers around ensuring that there is capacity, in every office or every, I'm sure there's capacity somewhere in the state, we just have to find it, to be able to understand and take reports from children who communicate nonverbally or children who communicate in ways that are not typical of children without disabilities. So, that's a problem that is much more common than the one that the person who asked the question was addressing.
Good, thank you.
So, Joan, I am going to actually move us to a takeaway, but I have been thrown out of my site about 5 times, so I may well need you to track all the responses. I know you were going to ask that, but I'm going to shift roles a little bit here because my computer just doesn't want to let me back in. So what we wanted to do is we want all of the participants to think about something you're taking away from this particular session, what you've heard from Meg or what you've heard from Bridget, or it might be something you've seen in the chat or anywhere else in this. And while you're typing in something you're taking away, Meg, we'd like to ask you something that you took away from listening to Bridget. And Bridget, we'll be asking you something you took away from Meg. So let's start there. Meg?
I think the rigor of the research and the ways in which your programming can, in a very systematic, very organized way, impact so many schools and so many children. And it really just inspires me to think about what it looks like to do the work on a larger scale, because we are addressing a very large problem. So your program's capacity to work on a large scale is something that I'm very inspired by.
And let's go to Bridget, something you heard from Meg that you're taking away.
Well, I heard 2 things. One is really addressing organizational culture. We try to do that with our program, but I think it can't be the same depth in the way that Meg has worked so closely with the SEAM schools and really addressing the culture and organization of those particular schools, because I think it really does. It comes from the leadership at the top, it comes from the teachers, it comes from everyone really being engaged in the process of how do we protect children in this building. So that's one thing I heard that I think is so important. So often schools are reactive. They don't do anything until there's been an incident, but being proactive is critical. The other thing I heard is really addressing the needs of children with disabilities is given, especially, the rates at which they're abused is something that I think every school should take into account. It's something that was a little hard for us to do in our programs, but of course I'm always thinking about how we can make them better, and just thinking, wow, it would be great to talk to Meg about how we could, if we iterate on the Child Protection Unit and make some changes or add some things, how we could add a focus on that, because clearly it's so important, or working more with adolescents.
And Joan, what are you seeing in the chat?
Sure. So there's a lot of great things coming through, as you can imagine, but I think that the focus on empathy building has been really helpful, and to hear directly how that's being implemented. Another thing was just about what the special considerations and approaches that need to be considered when looking at with children with disabilities, and understanding how the personal safety program can be effective in the context of social emotional learning sort of programming. Also, that someone mentioned that it's glad they're thinking about this, that how care plans for people with disabilities might include touch, and the emphasis on touch, so that there's not confusion explaining what that is. And I think the last piece, there's so many great ones coming in here, Cordelia, so I don't want to sort of go through them all, but please, everybody, read through them and know that that you can not just download the PowerPoint afterwards, you can also access the chat afterwards as well. So there's some great pieces here that we'll definitely share with the speakers as well as we go through our debrief as well. So do you want to move on to the next piece, Cordelia?
Yeah, and it might overlap. People might want to just say what you just said, actually some in a takeaway, but another question we have, I believe in the slides, can't see them, is that one action you either really want to take or you're hoping others take as a result of what they've heard today. So really, just brief, Meg, an action you either are going to take or you're hoping others take. And for all of you listening, please type in an action. We hope things people are going to do as a result of attending this session. Meg. I'm going to read all the research about Bridget's program. That's the action I like. I'm really interested. Okay, Bridget.
What I hope that people will be inspired to do is look at how important it is to put universal programming in schools so that every child gets the skills, the information, and the support that they need in school, because that's where children spend so many hours of their day for weeks and weeks over so many years, and that's such a great place to really build the knowledge and the skills for children.
And Joan, what are you seeing? What actions are people talking about?
And I think you're right. There's a number of the sort of takeaways were also actions, and I think that some of the actions that were coming through here is the idea motivated to try to push this at a statewide level. Also, just the importance of listening to critics. And I think sort of looking at the difference, I think, Bridget, you explained between cognitive and teaching cognitive empathy as well as, that being a way, so as opposed to thinking about it differently as affective. Share the resources with school counselors in their school system. Thinking about public policy and maybe combining some different pieces that are out there already about Erin's Law or criminal justice reform, and thinking about how the focus on Second Suite might be integrated there. And then checking in with students about disabilities and special needs whenever you offer a curriculum, and do that both before, during, and after the programming. And I think taking this to a variety of different venues like a statewide task force, and just put more effort into collaboration with schools and teachers as a way to continue giving child sexual abuse prevention messages throughout the community. So those are just a few, and as you can imagine, there's just so many more coming through as well, and just really appreciate the excitement that at least I feel coming through this chat.
Great, thank you so much. Well, on the next slide, we have contact information for Bridget and Meg, and I noticed because some of the questions that were coming up throughout were people very interested in following up with both of you. So just to reiterate, you get the information there, and you can go back to the Prevent Connect site and get these slides, or very soon there'll be a recording of this, so that's something else you can share with people. And our final slide is to just say thank you so very much to Bridget and Meg for excellent information in a short period, clear conversation afterwards. It was just very helpful. and to our many, many participants that gave great feedback, raised different issues, helped each other throughout this, and all the tech folks and everybody at Prevent Connect CalCASA for allowing these to continue and handling all of that. And Joan, thank you very much for stepping up there as my technology went poof there.
Great. Just adding my thanks to a really wonderful presentation today by Bridget and Meg, and thank you also to CalCASA and Prevent Connect for continuing to focus on child sexual abuse and your commitment to that work. So thanks, everyone. And again, you can download the slides. Please share them with everyone. And thank you for joining us today.
And that concludes today's Prevent Connect Power and Prevention Ending Child Sexual Abuse web conference. Thanks for everyone for joining us today. And we really want to thank most of all of the participants. This is a very large session, and it's important because your voices and your work together. We encourage you to join us at future Prevent Connect web conferences and future Power and Prevention Ending Child Sexual Abuse web conferences. So thank you very much, and we look forward to seeing you online. We'll keep the text chat open for another few moments. Okay, take care. Bye-bye.
Thank you.
Thank you.
Thanks, everyone.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.